Alright guys, I have a couple considerations when you're using a standard walker. First of all, you want to make sure that all 4 contact points of the walker leave the ground at the same time and return to the ground at the same time when you're using the walker. Don't rock the walker, so don't pick up at the same time and contact the back 2 and then rock forward onto the front 2, because that tremendously decreases the stability that the walker provides. Also, you want to make sure there's no obstacles on the floor or around the patient when they're using this, because you don't want them to fall. So like a surface such as this with the tape and the all curled up and everything wouldn't be a good surface. Ask them about their home environment to make sure they don't have a lot of floor rugs that would get in the way of walker use, so that it's safe there. When you're using a 2-wheeled walker and a 4-wheeled walker, it is less stable than the standard walker, but it's also a lot easier to maneuver around obstacles. You don't have to pick up the walker, obviously. With the 2-wheeled walker, you would typically put sliders on the back 2 legs so that you don't have to pick up the walker. Make sure when you're fitting the walker that the walker hand grips come to the level of the greater trochanter. Should allow for about 20 to 30 degrees of elbow flexion, and that's the proper fitting for a walker. Alright, we're going to start with partial weight bearing. So to guard the patient, you want to position yourself to the side, slightly behind, and in stride with the patient. So I'm going to grab on the gait belt with my left hand and on her shoulder with my right hand. And I'm also making sure that I'm on the involved limb side, as that's the most unstable side for the patient, so if they fall, they're likely to fall to that side. Make sure you use verbal cues, that's very helpful for this. So we're going to start by advancing the walker. So walker, and then right, left, walker, right, left, walker, right, left. Okay. If she was non-weight bearing, we would have her hold her foot behind her like this with the knee flex. Don't let it rest on the ground, or an alternate way, she could hold it in front of her with her knee extended. Alright, now we're going to do the partial weight bearing going sideways with the walker. So again, we're going to do walker first, and then involved limb, and then uninvolved limb. Good. Walker, right, left, walker, right, left, and walker, right, left. And now we're going to go to the left and do non-weight bearing. So walker, and then support yourself on your upper extremities to the left, and walker, and left, walker, left. So now we're going to work on return to sit and also backwards walking with a walker. This is non-weight bearing. So again, we're going to go walker, and then step, and walker, and step, and we're going to pivot towards your left now, okay? There we go. And now we're going to go backwards. So walker, and step, walker, step, walker, step, walker, step, walker, step, and then make sure the back of their strongest leg contacts the chair, and the patient will reach for one armrest while holding the walker with the other, and then reach for the other armrest and lower themselves using their upper extremity strength into the chair. If this was partial weight bearing, it would be the same steps with just contact of both limbs on the ground.